Hello everybody, welcome back to my channel. It's me, Kendra. And before I jump into today's topic, I just want to go ahead and thank all of the new subscribers and to just everyone in general for leaving me comments, asking questions, because that of course is giving me ideas for what kind of nursing related content I plan to create on this platform. So I just want to say thank you. I started this channel back in February, and I remember just like maybe 2 weeks ago, I only had like 25 subscribers, and now I'm up to like 311, just around that. So thank you everyone. In today's video, I want to go ahead and discuss me working PRN and how that relates to me having health insurance, because I noticed that there were some questions and just a little bit of clarification that you all were asking for in the comments. So let's just go ahead and jump right in. The thing I want to say is that everyone's situation is unique, and it is important to do like a thorough assessment of your situation. My situation is completely different from some people's situation. So I can't, just because I'm giving you this information today doesn't mean that you can take it and apply it to your situation, because like I said, we're all different, right? So for me, I have to provide health insurance for myself. I do have 2 daughters, but their father, he works for a really good company that provides health insurance for him and the 2 girls. So as far as my children goes, I don't have to pay or cover their health insurance because his company covers it. And guess what? This company is actually a distribution center. They distribute alcohol like across the US or whatever the case is. And he does not pay for health insurance out of pocket at all. The company provides them with health insurance because they're unionized, and the most he'll pay for is like, of course, the co-pays, the ER visits, if there's any things like that, co-pay for medications. But as far as money coming out of his check to cover health insurance, no, he does not pay for that. So luckily for me, my 2 children are covered under his health insurance. For me, being that I work PRN, I actually have to purchase my own health insurance. So during the pandemic, when I worked for a very specific agency, I would pay for their insurance because it was not too expensive. And most of you might be familiar with that one agency. I don't want to say their names, but it starts with an A. So whenever I did contracts with A, I would always pay for their health insurance because, like I said, it was affordable and it was pretty good insurance. Like, I had gotten some dental work done. I was able to get new glasses with the insurance that they provided. So when I'm working with an agency that provides good insurance, I tend to sign on. In the meanwhile, I am currently not working with an agency. I am working PRN at a local hospital here in Baltimore, and I pick up 2 to 3 shifts a week. I would love to do more, but 2 to 3 is what I do. Predominantly 3 though. So out of that, that is how I pay my health insurance. How I found insurance was through a private, insurance person that I learned about from being on social media. So there's a lot of nurse influencers on social media, and one of them specifically promoted or like introduced this insurance broker to her audience, and I ended up contacting her, and through her I was able to purchase health insurance. Broker, her name is Paritha Patel. Now keep in mind, this is not a paid endorsement. She's not paying me. I'm not getting anything. This is not sponsored. I'm just giving you my real life situation. I contacted Paritha. She filled out the application or did whatever online application that she had to do, submitted it to the insurance company. Luckily for me, I didn't have to go get a medical. I didn't have to go get any labs drawn or anything like that. I guess based on my age and based on my medical history, I'm probably considered low risk. So within like 3 to 4 business days, I was notified that I was approved, and my health coverage began from the day she submitted the application or something like that. Don't quote me. I don't quite remember. So I actually pay for medical and I pay for dental. I did not get the vision coverage. I've been wearing glasses for like most of my life. I tend to pay out of pocket for my glasses because I don't get them yearly anymore. It makes no sense to, because my vision stays the same. I pay for my own glasses out of pocket. So I did not need vision included in that. I just have medical and dental. Medical because of course I like to get my annual physical and get my labs drawn just to see where I'm at. It covers my OBGYN annual visits. And for the dental, in case I need dental work done, but it covers my twice a year cleaning that's really important to me to have dental coverage so I can get my teeth cleaned. So basically that is what the kind of health insurance that I have. It is I think it's United Healthcare, and the insurance company, I believe it's Freedom Life Insurance. So what I'll do is I'm going to link Paritha's information in this video so you guys can have it just in case you wanted to call and maybe have a conversation with her to see what coverage and to see what you're eligible for. Now, I will say that if you are the main provider of insurance for your family, I don't know how expensive this can get. I can only imagine if you have like a husband and maybe 2 or 3 kids, it can get pretty pricey for a family plan. But that is where you have to become strategic on how you work. And what I do is when I work PRN, I guess this kind of runs into a little bit of like financial management. This is what I do. I manage my bills and my budget based on the amount of shifts that I need to work, right? This is definitely going into another topic. I was saying I manage my budget and bills based on how many shifts I have to work. So on average, I do 3 shifts a week, which is 72 hours bi-weekly. I get my paycheck and I'm able to pay my bills and save a little bit and do whatever I have to do. But now that I have this private insurance that I'm paying for, I may need to pick up an extra shift, an extra 2 shifts a month. Oh, I forgot to tell you guys the amount that I pay. So every month I pay $445. I think, yeah, that's what it is. $445 gets automatically withdrawn from my checking account, and basically that is how much I pay. And when I think about it, that's pretty pricey considering that if I were to sign on to work full-time at a hospital, I wouldn't be paying that much. But because I value my freedom and flexibility so much, it's kind of like a trade-off and a price you have to pay to get what you want. So what I'll do to cover the cost, like I say, is to pick up an extra 2 shifts a month, or definitely try to snag up the shifts that are offering a bonus payment. So basically that is just how I manage to pay for my insurance out of pocket. However, being that I am on TikTok and I do interact with a lot of other nurses on TikTok, I have read through the comments of how some nurses manage to get health insurance and still be PRN. One of the nurses that I follow, she actually stated that she works part-time at Starbucks. So she works at Starbucks, I believe 20 hours a week, and then she'll pick up 2 shifts at the hospital PRN, I guess just to keep her skills. She, just like me, she doesn't want to be committed to working full-time or part-time. So Starbucks is a pretty low stress environment. It's a good company to work for. Again, this is not a paid promotion. Starbucks is not giving me any coins for this, but Starbucks is a pretty good company to work for. I worked for them while I was an undergrad for my nursing degree. And at that time, I'm not sure if they offered health insurance, but I think now if you were to work part-time for Starbucks, at least 20 hours a week, you can get coverage, medical health and medical, dental, and vision. And I think it's a pretty good insurance. So nurses are basically finding other ways and they're doing other jobs to help cover their health insurance cost, and then they still pick up shifts at the hospital. So there's a lot of ways to be creative. You just have to do some investigation, and you kind of have to not be afraid to go out there and try something new. And I think that's what happens when we get caught up in this career of nursing, is that we don't want to step out of our comfort zone. We're told nursing is it, this is what we have to do, and we're afraid to check other options out. So that is pretty much it for my medical or health insurance coverage. I pay for it out of pocket. Paritha Patel, I linked her information in for you guys. So just check it out and see what you can do with that. If not, you can check out some other different ways. Like I said, nurses are working part-time in other companies that offer very, very good medical coverage where it's a low stress environment. You're not really doing too much. You're away from the bedside. So that's something you all can look into. Anyway, if you have any comments, any concerns, any further questions on this video as far as health insurance is concerned, you can let me know in the comments. I really don't have any more information on it. I did this video just to let you all know what worked for me as far as health insurance goes. But yeah, just let me know. And I will see you all in the next video. Thank you so much for subscribing to my channel. Thank you so much for watching. Thank you for liking and commenting. You all have a good day. I'll see you guys again.